Assalamualaikum and hello, my name is Miss Nazira Johar. I will continue our lecture with the title of Medical Malpractice. This is part 2. Okay, we will continue our lecture with a few cases that is malpractice cases, so that you can imagine, you can see the picture, the whole picture of the malpractice. Okay, we will discuss about 6 medical malpractice cases according to the latentlaw.com with their article of 12 most famous medical malpractice cases. The first case is failure to obtain a blood type. Duke University Hospital is a prestigious and respected medical facility. In 2002, it was the subject of national news when they performed a heart and lung transplant on 17-year-old Jessica Centillion, without ever checking the blood type of the organ donors to see if they match. This is standard medical procedure. After the Duke doctors transplanted the organs, Jessica experienced severe brain damage and her body went into shock and shut down. It was only after this that the healthcare providers realized that the donor of the new organ did not have the same blood type as Jessica. To make matters worse, the hospital covered up this mistake for 11 days, then went public seeking another donor. By then, it was too late as Jessica has sustained fatal brain damage. The doctor took responsibility for the error, and the hospital implemented a new system to double-check transplants in order to prevent similar errors from occurring. In this first case, we would identify the elements of malpractice that was written in this story. Okay, the first element is duty. As we can see here, there are a duty that should be followed. This case was done by a team of doctor and his staff, and the standard of care is they should check the blood type of the organ donors to see if they match. This is the standard that they should follow. Okay. Element number 2 is the breach of duty. Yes, there is the breach of duty is done when they don't ever check the blood type of the organ donors before the surgery is performed. Number 3 is forcibility. We can see the link between the damages of the patient's brain and body and the action of did not checking the blood type. The link is the damages that occur because of the blood reaction between the patient and the organ donors, and what happened just after the surgery is performed. Okay, so that is the link. Number 4 is causation. Causation, the mistake done is the cause for the injury. That is the element of causation is there. Okay, number 5 is harm or injury. The patient experienced severe brain damage and her body went into shock and shut down. This is the harm or injury that was occurred to this patient. Number 4 is damages. The damages is the fatal brain damage. The brain of Jessica has turned into the brain death. Brain death. Okay. So that these are the elements of malpractice that we could identify from this case. Okay, we have another 5 cases to go, and I really hope that you will be able to find which elements is written in the cases after this. Okay, we look at the case number 2. Surgery on wrong side of head. Wrong side surgery is what is called a never event in medicine because it is never supposed to occur. Yet it does with alarming frequency even today. Neurosurgeons at Rhode Island Hospital made not one, but 3 catastrophic medical mistakes by performing wrong-side surgeries on 3 different patients' heads in 2007. 2 of the mistakes were caught early enough to close the initial holes and treat the correct side, but the other surgery killed an 86-year-old patient. Believe it or not, the surgeon who made this mistake had his medical license only suspended for 2 months. So much for doctors policing themselves. Case number 3. In one of the most tragic surgical errors, 52-year-old Willie King was supposed to have a diseased leg amputated in 1995. Instead, the surgeon took the wrong one off. As in many wrong-side surgery cases, there were a series of mistakes that led to the wrong leg being amputated. The incorrect leg was listed in the number of key places, including the blackboard in the operating room, the hospital's computer system, and the operating room schedule. The staff had sterilized and prepped the wrong leg for surgery before the surgeon, Dr. Rolando Sanchez, appeared in the operating room. The doctor's defense later was that both legs were unhealthy and would have to be amputated. He was fined $10,000 and received a 6-month medical license suspension. The case against the surgeon and hospital was settled for $1.15 million. If we go through this case, we could identify that is not the surgeon. The surgeon only made the mistake. The mistake was done in the operating room because they have listed the incorrect leg on the blackboard in the operating room, and someone who entered the information inside the computer system also made the mistake, and someone that put the patient's name in the operating room schedule also made the mistake. Maybe it was done by one person, but maybe not. Maybe so many people involved in this case. And the staff had sterilized and prepped the wrong leg for surgery. And again, the mistake also occurred here. And Dr. Rolando continued with the operation without double check again the correct leg. So they have to pay for $1.15 million for the mistakes, and the hospital and also the surgeon has to pay. Okay, the 4th case is wrong sperm used at fertility clinic, baby born of different race. A couple who was seeking fertility help was surprised to learn that the fertility clinic used sperm from another man to inseminate their eggs. During the in vitro fertilization, New York Medical Services for Reproductive Medicine used someone else's sperm in Thomas and Nancy Andrews' egg. They had no idea until their baby was born in 2004. It was then that they noticed the baby's skin was drastically darker than either of the Andrews. Lab results and DNA testing revealed that Thomas was the baby's biological father. The baby was of a different race than her parents. The Andrews brought a case against the owner of the clinic and the embryologist who processed the egg and sperm for insemination. Case number 5. Tumor removed, instrument death. In 2000, Donald Church underwent surgery at the University of Washington Medical Center in Seattle. He was supposed to have an abdominal tumor removed. Surgeon did take out the tumor, but in its place, they left a 13-inch metal retractor. It took 2 months of pain before the surgical mistake was discovered. Mr. Church recovered $97,000 in damages. While this mistake should never occur, this was the 5th incident in 5 years where this particular hospital surgeon had left surgical instruments in patients. Do you know what is retractor? This is retractor. Can you imagine? This instrument is left inside the patient's abdomen. See? It's sharp and it's very hard and it is stainless steel. These are the surgical instruments that could be left inside the patient's body. If you see here, of course you must think that it's illogical to leave such instrument inside the patient's body cavity. But during surgery, everything will turn red because of the contact with the blood. This gauze will be seen as one of the body organ if we did not tie this rope with a forceps. We have to put this rope on forceps, for example like this. Before this, everything is turned red and you cannot identify whether this is abdominal sponge or an organ. Okay, and this is an example of X-ray film whereby the instrument is left inside the patient's abdomen. Case number 6. Unmarked valve cost photographer his life. In 1985, award-winning Miami Herald photographer Bob East was diagnosed with corneal cancer. His eye had to be removed. East decided to have it donated to the medical school to use for medical students to study eye cancers. While he was having the surgery to remove his eye at Miami's Jackson Memorial Hospital, someone involved in the removal brought a vial into the operating room with a formaldehyde-like solution used to preserve the eye for science. The surgeon had earlier drawn some CSF fluid from the patient to be re-injected into his spine. Instead of the CSF, the formaldehyde was injected into Mr. East's spine, rendering him brain dead. He died 5 days later. An autopsy showed the solution had turned his organ to stone. The catastrophe resulted in policy changes requiring no unmarked valves to ever be brought into an operation room. Do you know what exactly inside this vial? If there is no label at a vial like this, anything can be inside this one. Even though you have been working, for example, in an operation theatre, and you have been working for many years with the drugs inside the theatre, but mistakes still could happen. Do you know what is formaldehyde used for? Have you heard about formalin? Yes, formalin is the other name of formaldehyde. Have you heard about the usage of formalin for dead body? Yes. Formalin is used to preserve a tissue or an organ. That's why the organ of the patient in this case has turned into stone and the patient died. Because of the reaction with the formalin, the formaldehyde. To enhance your understanding regarding the malpractice, I would like to show you a video from YouTube regarding the litigation of malpractice cases around the world.
Unneeded breast removal. In 2007, Danny Eason was given the unfortunate news that she had breast cancer, to which she simply responded, "Please don't let me die." Chilling words, and if this wasn't bad enough, she was told that the most appropriate treatment to have would be a double mastectomy. Reluctantly, she agreed, and both her breasts were surgically removed. After the procedure, it was discovered that Eason never actually had cancer to begin with, and the mistake in all the following procedures were due to mislabeling by a lab technician, who needless to say was fired. Number 9. Babies given a near-lethal overdose. Hollywood star Dennis Quaid and wife Kimberly Buffington were at the center of a media storm back in 2007. Their 2 twins were given heparin in their IV cannulas in order to flush them and aid the breakdown of blood clots. Unfortunately for the Quaid family, the twins were given the adult dose of 10,000 units instead of the 10 units normally given to newborns. This mistake proved near fatal for the twins with severe internal bleeding, but after the mistake was caught and the babies were treated, the condition began to improve after 41 hours and they made a full recovery. It was found upon investigation that the mistake occurred because the pharmacist stocked the wrong shelves with the medications, which at the time looked nearly identical. There's a dark joke about the twins in there somewhere. Number 8. Wrong testicle removed. US military veteran Benjamin Horton underwent the removal of what was supposed to be his left testicle due to the potential for cancer cells spreading. Unfortunately for him, and unknowingly to the surgeon however, the wrong testicle had been marked and Benjamin lost his right, healthy testicle instead. Horton and his wife, obviously angered and shocked at the mistake, sued the West Los Angeles VA Medical Center for $200,000. A lot of money, but not really a drop in the ocean when considering all the medical complications that a lack of testosterone can bring, including the need for exogenous hormone replacement therapy, fatigue, sexual dysfunction, and depression.
We have seen 3 cases in the video. The first one is unneeded breast removal, the second one is baby was given a little dose of heparin, and the third one is wrong testicle removal. For example, for the first case, in 2007, Danny Easton was undergone unnecessary double mastectomy, or both of her breasts was removed in a surgery. After the surgery only they found that she actually don't have any cancer, and the mistake came from mislabeling of the sample by a lab technician. So sad story. Dear student, we have come to the end of this part 2. We will continue our discussion regarding the malpractice in the next part. Thank you.